everyone. I'm Dr. Teizeem. I'm a pediatrics and neonatology specialist and healthcare consultant on MedSynapse medical platform. Today, I'm very happy to have Dr. Dhanji with us on MedSynapse medical platform. So welcome, Dr. Teizeem.
Thank you so much for having me.
So, Dr. Teizeem, first of all, I would like to know more about your medical background. I know, of course, that you are a consultant child and adolescent psychiatrist and also specialist interest in eating disorder. But can you just let us know more about your medical background?
Absolutely. So I did my medical training in the UK, and including my sort of specialist psychiatric training. And during that time, one of the specialties that I was specializing in was eating disorders and also family therapy. So when I became a consultant, I did about 4 years in the UK, and then I moved to the UAE. So currently I'm in Dubai, at Sage Clinics in downtown Dubai. And one of my, very special interests is working with children and adolescents with eating disorders. But of course, I see the breadth of child and adolescent mental health care.
Oh, such a great experience, doctor. So today we will talk about a very interesting topic, which is anorexia nervosa in children. First of all, I would like to know from you, what is anorexia nervosa and how does it differ from other eating disorders as well?
Yeah, so anorexia nervosa is a serious mental health illness because it has, an impact both on your psychological health, but also your physical health.
Yeah.
It's one of the eating disorders, and it's categorized by having a low body weight. So often the young person or adolescent, or if it was in an adult, will have lost a significant amount of weight.
Okay.
And that can cause a distorted sense of their body perception. Often they have behaviors such as either restricting food, maybe purging, so that could be vomiting or using laxatives, sometimes over-exercising. And what can happen is that can really affect your psychological health and your physical health. So it's different to some of the other eating disorders in that there is a low body weight. And if we think about something like bulimia nervosa, so the predominant thing in bulimia nervosa will be binge eating. And the person is binge eating sometimes, multiple times a week, with compensatory behaviors related to that. So again, that might be over-exercise, restriction, or vomiting. In binge eating disorder, they have the binge eating, but without the compensatory mechanisms. So all of the eating disorders have in common that there is a fear of weight gain, apart from one eating disorder, which you may have heard of, which is called ARFID. So that's avoidant restrictive food intake disorder. And so this is what we used to kind of classify children as, being fussy eaters. They do have a low body weight, but there isn't a body image disturbance. So it's not that they're trying to lose weight, although they will be significantly low in their body weight. And often it can be caused by issues with either, a concern for an aversive consequence. So that might be something like vomiting or worries about choking. It might be that they have sensory disturbances, so difficulties with textures of food, or maybe even, smells of food. And that's often seen in children with autism.
Yeah.
Or it might be that there's just a lack of interest in eating.
Yes.
And so then that causes a significant low body weight, but the difference is that there isn't this fear of weight gain.
Mm-hmm. Okay. So, doctor, I would like also to know, what are the symptoms, the physical and psychological symptoms of anorexia nervosa? How can me as a mother tell that my children are having anorexia nervosa?
Yeah, so because I said it affects somebody physically, it actually affects all systems of the body. So often young people will say that they have no energy, that they're feeling dizzy or faint because they haven't had enough nutrition. It can affect the heart sometimes, so it might be that people have a very low heart rate, or as I said, they're dizzy when they're standing up. It can affect the muscle around the heart, causing a lot of issues, in terms of the cardiovascular system. We also see that it affects things like your hair and your nails and your skin. So a lot of people will say that they've recognized hair loss, brittle nails, or dry skin. In females particularly, it can affect your reproductive system. So you've got, in terms of loss of periods. And if you lose a significant amount of weight, children who previously have had monthly periods might have either a reduction in, the number of days that their period lasts, or actually miss their period altogether. And then that goes on to affect things like your bone density, the risk of osteoporosis in the future. So those are some of the physical consequences. And so as a mother, some of the things that you might see is that, you might see, again, like, your child's lost their period, or maybe they're feeling like they have no energy. They don't want to get up in the mornings.
Yeah.
And you might see some of the behaviors that we talked about. So maybe they're spending a lot of time in the bathroom after meals, or maybe they're making excuses for eating with the family. So, they want to skip meals. Psychologically, it can really affect us. So we talk about something called starvation syndrome. So when somebody is malnourished, there are those physical consequences, but psychologically it can cause them to feel much more depressed, wanting to self-isolate, a lot of anxiety. Sometimes their thinking might change, so they become quite obsessive and rigid in their thinking. And often this can result in a lot of social isolation. They don't want to go out, be with their friends, because they're not motivated, or they don't have the energy to do that. And then we worry a lot in anorexia nervosa with the psychological risk. So often, because people are, they'll say that 80 or 90% of their day, all they can think about is their weight and their eating.
Yes.
And that means that it, can make someone feel quite distressed and low in their mood. So there is an increase in self-harm and also suicidal risk in anorexia.
Okay, and what are the causes of anorexia nervosa? What causes this specific disorder?
Yeah, and that's a question we get asked a lot from people. There isn't a specific cause, but there are many, many risk factors. So if we think about childhood and adolescence, it's a time of a lot of transition. Young people are going through developmental changes, puberty, hormonal changes. They're also, the brain is still not developed. So, the brain doesn't fully develop until you're around sort of 25. And so if there's a disruption in this maturation and this development, the hormonal changes, then it can lead to a lot of difficulties in emotional regulation, in how the young person might respond to certain situations. So it's a time of a lot of transition. So some of the risk factors might be things like, we look at a biopsychosocial model. So genetics might be a risk factor. If somebody, a first degree relative, has had difficulties with an eating disorder in the past, then it might mean that the child is more likely to develop an eating disorder. It could be as a result of, COVID played such a huge part in terms of the amount of cases that we were seeing with eating disorders. So the underlying thing there, we would probably say, is high levels of anxiety and probably social isolation. Children were out of school, not engaging with peers as much. There was a lot of emphasis on, doing some activity, and people were really worried about weight gain during COVID. But there was a lot of uncertainty and anxiety about when will school start again? When will I see my friends? What can I do? What can I not do? Am I going to catch COVID? And that anxiety can really lead to people wanting to control something. And unfortunately, food was one of those things, which meant that we saw a lot of increased incidence in eating disorders during that time. And then we can't forget things like social media. It plays such a huge role because, yeah, exactly. I think, people see, people's perceptions of what they should look like and what they need to be doing is really different. So we see all these filtered images, a lot of Photoshop. We see, there's this thin ideal, which comes across in social media. And so often young people are feeling like they're never doing enough. You see the celebrity posting, what they do in a day in terms of their exercise or what they're eating in a day. And it just makes us all feel like we're never doing enough. So I think all of these can be risk factors.
Yes, it's true. Social media has a big impact now on everyone, children and adults. That you're completely
Yes, absolutely. Yeah, and it does really make us, second guess our own body image ideals and really think about those things.
Yes, because they're sharing everything on social media now, and people just don't realize that not everything on social media is really true. It's not their life, it's not their daily life. So you're completely right about this part of social media, especially. So how can anorexia impact a child's social life, relationships, academic performance in school, in college?
Yeah, so as I said, I mean, we talked about all of the mood changes that can happen. So often there is no energy or motivation to want to socialize. But then socializing can be really, really difficult because a lot of socializing is around eating. And if somebody is, worried about social eating, worried about eating in front of others or what other people will say if they, only eat a small amount, then that can be a lot of pressure. So often, children will say that actually they've stopped socializing with their friends or they don't want to go out anymore. And then, it does also affect relationships in terms of home relationships, because the eating disorder doesn't only affect the individual, it affects all the systems around. So school, family, social systems. And the family can be, stuck in this kind of like maintenance cycle sometimes of the eating disorder, which is really difficult to come out of. So, young people might not want to eat with their families. They might not want to go to social gatherings or family gatherings. There were a lot of arguments around eating. Why aren't you eating? You need to come and sit with us. And I think that can create a lot of tension. Sometimes it can make the family environment really difficult to manage.
And I guess some families don't understand that their kids have a problem. They just insist on them eating with them, and they're not even questioning what's wrong with my kid. They just want them to eat regardless of everything. So I guess awareness could be a good part for the parents to try to understand their kids more and try to start asking questions about their habits, their eating habits as well, right?
Yes, absolutely. Often, and that partly is, partly the parent might not understand what's going on, but partly the child might also not have insight into their eating disorder. So they don't think it's as serious. They think that they're just trying to lose a bit of weight. They're, trying to maybe help their self-confidence and self-esteem. And they can also, when I see people in clinic, they'll also sort of say, well, I've not got a problem. There's nothing wrong with what I'm doing. And there's that distorted body, perception. So they don't understand the seriousness of it. But you're right, parents might not understand. And, often parents will say, well, why can't you just eat? And it's so difficult to tell an eating disorder, a child with an eating disorder that, why can't you just eat? Because that level of distress and that preoccupation with what they've just eaten or what they're going to have to eat in the day is, just so distressing. There's a lot of guilt and shame around an eating disorder.
Okay, doctor, and how do we treat anorexia nervosa? What are the approaches for treatment? So,
if we think about the kind of first line evidence-based treatments for anorexia nervosa in children, it is a family-based approach. So we really recognize that families are integral in terms of helping a young child or an adolescent with the recovery.
Okay.
So what that means is that in the initial phase of the illness, the parents are really involved with supervision, monitoring of food, trying to help get the young person back to a healthy weight. And the reason that this is so integral is because we want to try and reverse the physiological and psychological effects of starvation syndrome. And if we're able to do this in a shorter period of time, the prognosis is better, you get better outcomes. So initial weight gain is really important, and we need parents' support to be able to do that. And then in the latter stages, we're, of course, managing any comorbidities, things like depression, anxiety, OCD that might be there, body image difficulties that the child has, trying to then help them to kind of move to a place where they're more independent with their eating, where they can go back to intuitive eating, social eating, trying to support them with other things, because some people might have come after a period of bullying at school, or
Yes, of course.
it might have really affected their academics. Maybe they had less focus, were really distracted by the eating disorder, and so their grades have dropped. So really we have to look at it holistically. And then the last stage of the treatment would be related to kind of relapse prevention and how to help support the person to make sure that relapse doesn't occur. So that's the family-based treatment. There's also individual treatment, and that's cognitive behavioral therapy for eating disorders. So you're focusing more on trying to help challenge their thoughts, looking at the specific behaviors that they have and how behaviors are maintained.
Yes.
So a lot of young people will do things like mirror checking, but each time you check your mirror, look into the mirror and you're kind of looking at your weight and shape, that causes a lot of negative cognitions. Yes. It sort of maintains your feeling that you're not good enough. Yes. And so how do we deal with all of these types of behaviors? And that will be done through individual therapy.
Okay.
And then sometimes with children, we might need to think about medication. So that, again, might
Yes, I was going to ask about that part of medications, yes.
Yeah, so, the medications might be to treat the comorbidity. So like a depression, anxiety, you might be using antidepressants. But sometimes also if somebody is really preoccupied, they're really distressed, there's a lot of thoughts. Sometimes children will say they kind of hear voices telling them that they shouldn't be eating, that they're too fat, that, they shouldn't have had that. And that can be really distressing. So it makes the treatment really hard. So sometimes low dose antipsychotics can be really helpful.
Yeah.
Maybe olanzapine, quetiapine, just to help that distress, reduce some of the inner critical voice. Mm-hmm. And that can, that might help them progress through treatment.
Okay. And how do you think we can prevent this disorder? How can we do, us as parents, school providers, health providers, do you think awareness can be something beneficial in this space?
Yeah, absolutely. But, if we think about schools, often it's schools that will refer children or will talk to parents to say that they've identified concerns. Your child is spending their, largest bulk of their day at school.
Most of their days, yes.
Yeah, most of the day, and having a lot of meals at school. So if, a child could come home and sort of say to their parents, no, I had a really big lunch, or, I've already eaten with my friends, and can kind of get away with some of those behaviors. But in school, it's really obvious if the child is not eating and is hiding or throwing their food away, or spending, a lot of time in the bathroom. So schools are, a key source in terms of helping. And we think about the kind of general education and awareness. So, through assemblies and the curriculum, and making sure that they're really, thinking about mental health awareness, but eating disorder awareness. Trying not to label foods as good and bad, because I think often then, people kind of don't really learn about balance and moderation. They just see things as being bad for you, and that you shouldn't have those foods.
Yes.
And then also trying to think about role modeling. So often, schools might do things like weigh children in front of their peers. So obviously that's not a good thing. Staff maybe sometimes don't prioritize eating because they're busy doing other things.
Exactly.
And then, children don't prioritize the eating. Especially a lot of children will come to clinic and say, well, I only have like 10 minutes at lunch because I have all these activities that I'm doing.
Yes.
And so then they skip their meals. So I think really role modeling and really prioritizing eating is important. Letting parents know early on if there are any concerns.
Yeah.
And then if we think about like general kind of health provider sort of awareness, screening is really important. So I know definitely something that they're doing here in the UAE, it's called the Mental Wealth Framework, is that they're screening school-aged children in GP surgeries to look for anxiety, depression, and eating disorders. These are the three main areas that they're working on, so that it can be identified early. And we know early intervention means that the outcomes are much better.
Of course.
And lots of people will go to general practitioners or endocrinologists because they've lost their period and things like that. And sometimes health providers will kind of watch and wait, but I think, that early intervention is really important, and asking the right questions. Is it because of weight loss?
Yeah.
Is there an underlying body image issue there? So, we do a lot of health awareness in schools with health providers to try and help kind of support that, because that early intervention is so important.
Of course. And early prevention is really important in any other disease, not just anorexia nervosa. It's always better to prevent the disease than having the disease and all the consequences of it. So, yes.
Absolutely. Yeah. So, I really prefer to see, and I always say to parents when I'm doing mental health awareness, is I prefer to see people when they have disordered eating or body image difficulties rather than when they have already developed an eating disorder, because actually then we have something there that we can really work on and try and help prevent them get to a more serious place.
Yes, exactly. So, Dr. Teizeem, it was a pleasure to have you today, and thank you so much for this informative podcast. I'm looking forward to have more and more podcasts with you and talk about different topics with you. Thank you so much.
Thank you. You're so welcome. It was really nice to meet you as well.
Thank you. Have a nice day.